And our next speaker is Dr. MORYA. Dr. ARVIND is going to talk on complex situations in the heart cataract.
Thank you, sir. Good afternoon, everyone. And thank you, AIOS and Dr. Rajendra Prasad, sir, for giving me this opportunity. So my talk is on approach to hard cataract phaco with appropriate technique and settings. So I will be discussing in brief about the terminal chop technique. It's a new technique for nuclear fragmentation. It was introduced and invented by Dr. Rajendra Prasad, and it is suitable for medium to hard grade of cataract. It reduces surgical time and chances of complication, and this technique was first published in IGO in year 2016, and we are practicing the technique since 2013 when Dr. Prasad first described the same in a conference. So this is a small video in which a very lean person is dealing with a very hard rock. So this technique is based on Griffith's theory of brittle fracture, in which blunt forces are given to the weakest point. This is how. Only the blunt forces are given and it is divided the rock. So this is the brief about the surgical technique. First, very good capsular axis, little bit larger when we are dealing with the hardest of the cataract, and a short superficial central trench of 1:1:1 mm size is created to hold and engage the phaco tip. Then the phaco settings are changed to high vacuum settings, 450 to 500 mm of Hg with 50 to 80% power and 30 to 35 ml per minute of AFR. Then the phaco tip is engaged at the distal end of the trench, and then the phaco probe is impaled superficially only, keeping the tip directed towards the equator, and it's parallel to the pupillary plane. It's not directed towards the optic nerve. To achieve firm hold of the nucleus just within the equator, then the equator is drawn within the capsulotomy edge, and under direct visualization, a wedge-shaped blunt olive tip chopper terminator is simply passed around the lens equator to have a hold. Then it is dragged 1.5 to 2 mm through the open edge equator to create a very small groove. This dragging generates tension and dispersive forces along the sides of the groove consonant to drag pick and rock excavation system and initiates a full thickness nuclear crack. And this full thickness crack traverses automatically across the lens to the other end of the equator and divide the nucleus into two equal halves. So this is the terminator chopper. It needs to be kept in the lateral position, and with both the chopper and the phaco probe, a splitting force at 90 degree is generated, and this is propagated from the equator to center and on the equator of the other side. The force is working along the brittle lines, and inside out dispersive mechanical forces are used to crack the nucleus. This is how it is. The phaco tip is superficially impaled and it's parallel to the pupillary plane, right? And this blunt terminator chopper direction is away from the phaco probe. So this is a small video in which we are having a grade 5 cataract nigra. So we can't expect cataract much harder than this. So this is the specially designed olive tip terminator chop, the wedge tool, to deal with such kind of hard nucleus. You can see the edges. So its tip is blunt. So superficially impalement of the phaco tip starting from the center, and within the capsulotomy edge this specially designed terminator chopper is passed, and now the direction is away from each other, and you can see a full thickness crack. Again a little bit softer cataract in which a trench is made in the center, superficial impalement within the capsulotomy edge. Now two heminuclei we have, and with the same technique these heminuclei are further divided into smaller pieces and phaco-emulsified quite easily. going behind the equator. So as we compare with other technique, this terminal chop technique, the instruments tip, they move away from each other at the equator, and only the superficial impaled phaco probe and chopper parallel to the iris plane, and it propagates the initial crack into a full thickness fracture in low compressive stress. Whereas in the horizontal chop, the instruments tip move towards each other in the horizontal plane at the equator, and the phaco probe deeply and direction is towards the optic disc, and it creates a stressful compressive force. Whereas in the vertical chop, the instrument tip move towards each other in vertical plane and chopper towards the optic nerve, and it creates in plane shearing force with very high stress. So we have got this study published, and also it has been presented at ESCRS, and we have just completed a randomized control trial in which this terminal chop technique between stop and chop and direct chop technique, so it is superior as we compare the ergonomics of the phaco. Thank you so very much.
Thank you, Dr. Arvind, for the excellent presentation and showing the terminal chop technique. Actually, this technique, the basic principle of this technique is different from the horizontal chop. In this technique, what you are doing, you're cracking first, you're cracking the nucleus first and then separating. So crack, and then with the lateral separation, the remaining fibers you are separating, and you get a complete full thickness nucleus, two pieces. While in horizontal chop, what we do, we put the chopper at the periphery, drag it towards the center, and then we split. We split, put the lateral separation force to crack. So these are two different things. See, if you have a big stone, if you have to break that stone, either you start cutting it, then break it, or you crack it with a very simple instrument, which is called as a chisel. Just put the chisel at one point, hit it, and you crack the big stone into two. So two different principles. You crack, split and break, or you split, then crack, then break. So forces are going to be different in both the situation. If you get a crack initially, later on this forces is going to be very low. You are going to use very less energy, very less force, very less manipulation. You are not going to put any stress on the posterior capsule, anterior capsule, so you get a complete separation of the nucleus. So that is the basic principle of this technique, and it works very well. And at the same time, because as he has shown, the cracker, it has a olive tip, it's a round tip, and it has a wedge inner edge. So round tip means when you're hooking the nucleus with this chopper, this cracker, even if you hit the posterior capsule, nothing is going to happen. It's not going to damage the posterior capsule in any situation because it's a round tip. While the choppers which we use for the horizontal chop, the sharp choppers, if you go a little behind, you can hit the posterior capsule, and that is the reason you get a lot of complication of the posterior capsule rupture and all with hitting with the chopper. But this chopper has a round tip. Even if you hit the posterior capsule, nothing is going to happen. Then this chopper has a wedge inner edge. Wedge means this is a simple device, wedge. So any wedge, when you are entering through any object, is going to separate the object. So that is the lateral separation force it gives. So it converts the radial force into the lateral separation force. So you get a complete cracking. So that is the idea of this technique, and it works very well in hard cataract, and a lot of younger people are using this, and even the many senior people are using this technique.
Luckily, the inventor of this chopper is Dr. Rajendra Prasad, sitting here with us.
Yeah, thank you, Dr. Arvind. Beautiful surgery, very clearly shown